I am so excited that you're back with us at the other Prince William podcast. You know, I always say there's this guy that's across the pond that's going to be king someday. What are we going to be? Well, the other Prince William podcast is here to highlight change makers shaping our community. This season, we're diving into the stories of innovators, advocates, and leaders that are turning challenges into opportunities and making an impact on Prince William County.
Today, we are joined by two dynamic women who sit at the intersection of healthcare and community connection. Michele Eckhardt is the Physician and Community Relations Director at Sentara Northern Virginia Medical Center, where she helps connect providers and patients and local organizations. She works closely with my organization, the Human Services Alliance, to create healthier outcomes throughout our region. Welcome, Michele.
Thank you.
And Rozlyn, Giddens, my good friend, is the program manager at UVA Health. The three of us were in the 2024 We Do More cohort of Leadership Prince William. She's at UVA Health, where she leads the work building strong, trusted relationships in the community and helps make healthcare more accessible and equitable. Both Sentara and UVA Health are deeply involved in data-driven, people-centered efforts to improve health in our region. And today, we are going to learn how that work happens behind the scenes.
We've got an icebreaker question. So if you could change, Michele, one thing about the local healthcare landscape tomorrow, what would it be?
I think our greatest opportunity within the healthcare landscape is really access to healthcare and having affordable health insurance available to everyone in our community, so that we are breaking down those barriers to access to healthcare. At Sentara, we have the very good fortune of also having a health plan. Sentara Health Plans is a nonprofit entity, unlike many health plans available in our country. And our goal is to provide access to Sentara Health Plans so that we have more covered lives, within our communities. Sentara Health Plans grew in the Northern Virginia market over the last number of years, and our network development has been exceedingly robust. So we are working towards that end.
Rozlyn, same question. If you could change one thing about the local healthcare landscape, what would it be?
Access to care is continually an issue that Michele also mentioned. We want to make sure that people know where they can get health care, what kind of health care that they need. It would be amazing if our community had access, did not experience barriers, and knew how to overcome the barriers. So I would love to see more healthcare navigators in our community, whether it is your next door neighbor or your friend, your healthcare provider, that would be able to help you navigate and understand where you should go and where you can go, and if you need additional help and resources, how to get access to those.
That is my biggest problem. It's self-advocacy. Like I never know when to go to the doctor, or maybe not go to the doctor. Either way, sometimes I get panicked in my brain and I'm like, I should go to the doctor. And then other times they're like, no, you're just breathing, whatever it is.
I think we also see, within our communities, accessing the right place of care and understanding whether you should be visiting your primary care provider, or if this is in fact something that could be addressed at an urgent care center, or differentiating when something is truly an emergency, so that care is provided urgently. So we have historically seen a great deal of confusion, and I think the default has been just go to the emergency room. And so we see some overutilization of emergency room services, where things could be just as well addressed, in an urgent care center, or managed health conditions, more chronic health conditions, managed by a relationship with a primary care provider.
Hi, I'm Lovey Hamill. I'm CEO of Employment Enterprises. And we're so proud to sponsor the other Prince William County podcast in order for us to celebrate our 45th anniversary. You can find us at www.eeihr.com. Call us when you want to take the stress out of hiring.
And both of your organizations are very present in the community.
Absolutely.
And I think that's how we gather the best information. So, Rozlyn, I'll start with you. Both UVA Health and Sentara participate in something called a community health needs assessment. For our listeners who may not be familiar, will you tell us a little about it?
Sure. So the community health needs assessment is the core of many nonprofit community hospitals, as Sentara and UVA Health, UVA Community Health are. And part of our work and our mission and values is to make sure that we are benefiting the community. So community health needs assessment is part of a requirement by the IRS as part of the work that we do as a community hospital. So we conduct a health needs assessment every 3 years, and as a result of that, it gives us an opportunity to collect data. So we will look at why people come into the hospital, why they come to the emergency room. We'll also talk to our community at large and talk to our local nonprofit leaders. And then we also survey the community itself. We want to hear and understand, what do you see are the barriers to healthcare and what are your top needs? So this process allows us over a long period of time to look and understand what are the significant health needs in our community and how we can address those.
I think that over time, there is a tremendous amount of data available to us, and it's really it's filtering that data and understanding what that data, the story that the data is telling us. But just as significantly, to Rozlyn's point, it is the voice of the community and having those community conversations, engaging focus groups, and garnering input from segments of our community and making sure that voices are heard. So that helps us to prioritize what needs are not being met, because we know what we are doing, but understanding where those gaps are is a great opportunity at the CHINA.
I love it. And this has been going on for some time, I imagine?
Oh, for as long as I can remember.
It has, but in 2010, the CARES Act came out, and there was this additional requirement that hospital systems across the country that are nonprofit would engage in this process. So many organizations, it was a core value, they were already doing it, but it became more organized and a requirement. And so we want to make sure as an organization and as a community that we're doing this. So this requirement is also part of what Virginia Department of Health engages in, and they call their assessment the community health assessment. And through their assessment, we all work together and partner, and I know Sentara has had the opportunity to work with them. We have worked with them on our health needs assessment in the past. So it takes all of us coming together, surveying and pulling and looking at the data, and again, looking at those trends and those opportunities where we can look at how we can meet the need in our community.
I love it. And I love the fact that now there's this timestamp on things. So you say 2010 it started. 16 years later, we're doing this every 3 years. We're going to be able to see how priorities might have changed over time, how communities evolve. I think it's going to be a beautiful thing. I really look forward to the release of the CHINA data later this fall. Michele, can you talk about some of the incredible partners that Rozlyn alluded to that you get to work with through the CHINA process?
Community Coalition of Greater Prince William has really been a champion in bringing together the various stakeholder organizations, including UVA Health, Sentara, the Prince William Health District, community organizations. The list is actually quite long. In fact, I did a quick count, and there are 80 different organizations who have participated in terms of input. The actual coalition is obviously a bit more intimate, but it does include our partners with Kaiser Permanente, as well as UVA Health System for our kind of regional look. So the partner list is quite long. It really is a collective effort. We all have a shared goal of meeting the needs of our community. And each of the entities will have a unique perspective based on your specific market and your organizational resources and how you can affect that kind of change.
OmniRide is your transportation provider for right here in Prince William County and beyond. We have lots of local routes in eastern Prince William, Manassas area, all of which are zero fare. We also have routes that can take you to the metro station zero fare for access into DC and points beyond. Just as important, we have our services on the I-66 and I-95 corridors if you need to reach the Pentagon, Crystal City, and of course our nation's capital. OmniRide is a proud sponsor of the other Prince William podcast.
I was just wondering if every hospital or hospital system has to adhere to the CHINA kind of mandates, rules, community engagement.
Everyone does not have the same requirements. So part of our community hospital is UVA Community Health, and we are part of the UVA Health system. And UVA Health is a state hospital. So based in Charlottesville, they do not have the same requirements. However, they do engage in a very similar process where they come together. Their process is called the MAP process, and they are pulling together with their leaders in community and coming up with how they're going to address needs. But community hospitals or nonprofit hospitals, as I refer to,
Right.
we are birthed out of a need, a specific need and a gap for care in the community. And so there was no hospital in our area many years ago in early 60s. And the community came together and rallied and said, hey, we need a hospital so we don't have to travel an hour to receive access to care. So as a result, some hospitals are community hospitals, some are categorized differently, but the core value that our hospital and most have is taking care of patients and understanding where we can help and meet needs in our community.
I love it.
Yeah, that's awesome. I think at the top of our show, we talked a little bit about access, right? And making sure that people have insurance so that they can get the services that they need. I think I'm going to start with Rozlyn. What efforts is UVA Health, Community Health, making to ensure that there is equitable access to care in our area?
So the beauty in being a community hospital is everyone has access. You can come to the hospital if you need care. It is not determined on whether you have the ability to pay, whether you have insurance. So our hospital is going to oftentimes underwrite and understands that there will be patients that come in through the doors that don't have access. But we have what is called a financial assistance program. And that program is a program that anyone can apply to and has a very high opportunity for people that need supplemental income or additional help with their medical bills. They have access to our charity care program and the financial assistance program. So that's an exciting opportunity for us, but we also want to make sure our community knows they have access to this. We also work very closely in relationship and partnership with our federally qualified health centers, our free clinics, to make sure that we are distributing this information and that they understand that no matter what your need is, you can receive the care that you need.
Likewise at Sentara, we too have those programs, and I think the partnerships with the safety net clinics is really key, whether it's the federally qualified health center or we have actually quite a number of safety net clinics available in greater Prince William County. which affords great access opportunity for either uninsured or underinsured individuals. At Sentara, we operate Sentara Community Care, which is a mobile clinic model where we actually in Prince William County have 2 mobile units that do outreach with our community partners and community organizations.
I see that.
Yes, we partner with churches as well as with community services agencies. We directly partner with ACTS, Action in the Community Through Service in Dumfries, and offer clinic services in partnership with them. The goal is offering those primary care services as well as management of chronic conditions, utilizing a nurse practitioner model. So yeah, there's a tremendous impact being made there, but we can't do it alone. It really, the Greater Prince William Health Center, we all know, is just a phenomenal agency that has matured beautifully in our community, and they offer services for uninsured as well as either underinsured or even insured patients.
Well, on those same lines, you see Prince William, and in our class, Prince William County has seen tremendous growth over the most recent years. And we just heard that by 2035, an additional 200,000 people are planning to move here from outside of our market here. And 80% of them are moving to your market down on the East End, 95, 200,000 additional people. So right now we're about 500,000 people in the county, 700,000 expected by 2035 from the county demographer. These are his words. And so from your perspective, what are some of the most pressing health challenges currently facing our community?
I think that from a demographic perspective, one of the greatest challenges that we have, it's also an incredible blessing, is the diversity of our community. Prince William County is the #1 most diverse county in the Commonwealth of Virginia, the 10th most diverse in the nation. So it creates a tremendous richness to our community, but it also creates some challenges when there are language barriers or cultural differences, understanding access to health care.
Yeah, it is our greatest superpower. What are your thoughts?
We are continuing as an organization, growing, increasing our practices, trying to make sure that there are enough providers to meet the need. Not only that, we are looking to attract those providers that reflect the community that we serve and live in, and that is a challenge. So as an organization, we are opening up more practices. We are increasing the size of some of the primary care that we do provide in the specialty clinics that we do have in the area, just so that we can meet that need. But that access continues to be an issue, and we want to make sure that we can, as a healthcare provider, meet the needs. So when someone needs to make an appointment, that they have access to that appointment. It is not of extremely long wait, that they are able to get in and get the care that they need. But we do see continually in our community that growth is an opportunity, and also making sure that we can recruit and draw in and attract the folks that can fill these positions to be able to care for our community. So those are some of our priorities as well.
I love how engaged and responsive both of your organizations are to our community and the diversity and the changes in our community. As a nonprofit leader, I'm always trying to connect the dots, because what we know is if somebody has high blood pressure, they probably got some other things going on as well, right? So folks who suffer from food insecurity tend to be the folks you see in your ERs, right? Tend to be the folks who need help with all kinds of things. So how can the business community and the nonprofit community support your work? I'll start with Michele.
I think it's not as much about supporting our work. I think it is the collective effort to address these issues. I mean, what you are referring to really are what we refer to as the social determinants of health, and addressing affordable housing and food security and behavioral health, safe communities, our built community. There's a lot of work that is already being done across our community by a wide variety of agencies and organizations. And that's the beauty, is that through these efforts, it's the collective impact where we are partnering with organizations to address specific issues, and nobody can do it alone. And it really—
Your quote, Michele, I love this. If you want to go fast,
go alone.
that's right.
If you want to go far, go with others. And that is truly the mantra by which we are engaged in this, body of work. I mean, together we can make tremendous impact on our communities.
You want to add something, Rozlyn?
We're always excited as an organization to partner and make sure that businesses are encouraging their employees to prioritize their health. Prevention is the name of the game, so to speak. We really want people to prioritize nutrition and making sure they're getting exercise. And we believe that can be a cultural decision by a business. And we as an organization are excited to roll out our mobile mammography coach coming up this year. And businesses can reach out to us, and I'm sure probably other organizations, and throughout the year. But we know Cancer Awareness Month is coming, and inviting the mobile unit to your business and prioritizing and focusing on that. Reaching out to various healthcare organizations and inviting someone to maybe talk about some of the challenges or sleep deprivation or any topic that your business might experience, to bring focus back to health and making that a priority. So that's what we are excited about. We know that the Chamber is doing some exciting work to engage with corporate challenge, a wellness challenge. So all of those things make a difference and an impact on the health of our community.
We are so thankful you all could join us. This has been an awesome conversation. And thank you for sharing the insights on your organizations today. It is clear to all of us that building a healthier Prince William takes strong leadership and collaboration and a focus on equity. And so I think we're all working toward that. To our listeners, thank you so much for tuning in. Make sure you subscribe to the Chamber's YouTube channel. Find us on Spotify and Apple Music, and follow us on social media. We're everywhere to stay up to date on future episodes and community spotlights.
It's only on YouTube that you get to see the coordinating outfits. And of course, we couldn't do it without, but we would really like to thank our two major sponsors, OmniRide and Employment Enterprises, for their support of this podcast and their commitment to the business community of Prince William County. Thank you, everybody. See you next time.